Imagine hearing voices nobody else can hear, seeing things that aren't there, believing you were chosen by the gods themselves. In today's world, you'd be taken to a hospital, given medication, given a diagnosis. But what did ancient humans do with someone like this? The answer will completely change how you think about mental illness. Mental illness affects 1 in 5 Americans today. That's 60 million people. And we still struggle to understand it, to treat it, to talk about it. But here's what nobody tells you. Ancient humans dealt with mental illness too. Every tribe, every culture, every continent. And the way they handled it was sometimes more compassionate than anything we do today. Sometimes more brutal. And sometimes surprisingly wise. Today we're going to find out exactly how ancient humans understood and treated mental illness, and what we've lost along the way. First things first, ancient humans didn't call it mental illness. They didn't have that word, that concept. Instead, they saw unusual behavior through the lens of what they knew best, the spiritual world. Someone hearing voices, that wasn't a symptom. That was communication from the spirit world. Someone seeing visions, not a hallucination, a message from the ancestors. Someone behaving erratically, unpredictably, wildly, possibly possessed, possibly chosen, possibly both. Now, before you dismiss this as primitive thinking, consider something. In many ancient cultures, the person hearing voices wasn't shunned. They were respected because they could hear what others couldn't. They had access to a world the rest of the tribe couldn't reach. The tribal shaman in many cultures was often someone modern psychiatry would diagnose with schizophrenia. The village prophet, the spiritual healer, the one who spoke to the dead, all potentially showing symptoms we'd medicate today. But in ancient tribes, they were the most important person in the community. Let's talk about the shaman, because this is where ancient treatment of mental illness gets really fascinating. In hundreds of ancient cultures across every continent, the shaman was the healer, the doctor, the therapist, the priest, all in one. And shamans were often chosen specifically because of their unusual mental experiences, visions, voices, trances. These weren't disqualifying factors. They were the job requirements. Many shamans reported going through a period of extreme psychological crisis before becoming healers. Hearing terrifying voices, experiencing frightening visions, feeling like they were dying or being torn apart. Modern psychiatry would call this a psychotic break. Ancient cultures called it the shamanic initiation. The idea being, you cannot heal what you haven't survived yourself. And here's what's remarkable. After this crisis period, most shamans emerged stable, functioning, purposeful. They had gone through the darkness and come out the other side, and now they could guide others through it too. Modern trauma therapy actually uses a very similar concept today. The wounded healer. The idea that those who have suffered most deeply are often the most effective at helping others suffer less. Ancient humans discovered this concept tens of thousands of years before modern psychology did. So, how did ancient humans actually treat mental illness day to day? It wasn't just spiritual ceremonies. Ancient humans used surprisingly practical methods too. The first was community inclusion. Unlike modern psychiatric hospitals that separate the mentally ill from society, ancient tribes kept them integrated. The person struggling was never removed from the tribe, never isolated, never institutionalized. They stayed, they participated. They were given roles they could actually manage. Someone with severe anxiety might be given a quieter role in camp. Someone with what we'd call ADHD might be made a scout or hunter, where their restless energy was actually an advantage. Ancient tribes didn't try to fix people. They found where people fit. The second method was ritual healing, drumming, dancing, chanting. These weren't just entertainment, they were medicine. Modern neuroscience now shows that rhythmic drumming actually changes brainwave patterns, reduces cortisol, the stress hormone, increases dopamine, the feel-good chemical. Ancient humans discovered music therapy, thousands of years before neuroscientists put it in a lab. The third method was plant medicine. Ancient humans had extensive knowledge of plants that affected the mind, some calming, some stimulating, some inducing visions deliberately for healing purposes. Many modern psychiatric medications are actually derived from the same plants ancient healers used. The molecule in magic mushrooms that causes visions is now being used in clinical trials for treatment-resistant depression. Ancient plant medicine, modern psychiatric research, closer than you'd think. But let's be honest, not everything ancient humans did with the mentally ill was compassionate. There was a dark side too. In some ancient cultures, mental illness was seen as punishment, a curse from angry spirits, a result of moral failure, a sign that someone had broken a sacred rule, and the treatment reflected that belief. Trepanation was one of the most disturbing ancient treatments for mental illness. It involved drilling or scraping a hole into the skull. Yes, a hole in the skull. The belief was that evil spirits causing the mental illness could escape through the hole. Archaeological evidence shows trepanation was performed on every inhabited continent. And here's the most shocking part. Many of the skulls show signs of healing around the hole, meaning the patients survived. Ancient humans were performing brain surgery without anesthesia, without sterile equipment, without modern medicine, and people lived through it. In other cultures, the mentally ill were seen as dangerous, feared, avoided, sometimes abandoned, left at the edge of the tribe, alone, with no food, no shelter, effectively a death sentence. So ancient treatment of mental illness was not a simple story. It was complex, contradictory, just like our treatment of it today. Here's what gets me about all of this. We've had 100,000 years to figure out mental illness, and we're still struggling. 1 in 5 Americans has a mental health condition. Less than half of them receive any treatment. Suicide is the second leading cause of death for Americans aged 10 to 34. These aren't ancient problems. These are right now problems. And yet, some of what ancient humans did instinctively, community inclusion, purposeful roles for everyone, rhythmic music as medicine, plant-based treatments, the wounded healer concept, is now being rediscovered by modern psychiatry as some of the most effective treatments available. We spent thousands of years locking people away in institutions, separating them from community, medicating them into silence. And now, we're slowly returning to what ancient humans knew. Keep people connected, give everyone a role, use music and nature as medicine. Don't grieve or struggle alone. Ancient humans didn't have the science to understand mental illness, but they had something we'd lost somewhere along the way: each other. If this changed how you think about mental illness and ancient life, next week we're exploring something that will genuinely blow your mind. How did ancient humans explain things they couldn't understand? Thunder, lightning, disease, death. The answers they came up with changed the entire course of human history. Subscribe so you don't miss it. And comment below. Do you think ancient humans treated mental illness better than we do today? I'll see you next week.